Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. Research variables are qualities or properties or characteristics of persons, things, or situations that change or vary. Concrete concepts such as pulse or blood pressure can be referred to as variables in a study. Other concepts such as anxiety or pain, for example, are more abstract and observed indirectly. The properties of these concepts are generally inferred from a combination of measurements. Many qualitative and quantitative researchers study abstract concepts. They often refer to these phenomena of interest as concepts rather than as variables. There are several types of variables. An independent variable is an intervention or treatment manipulated by the researcher to create an effect on the dependent variable. A dependent variable is the outcome the researcher wants to predict or explain. Changes in the dependent variable are presumed to be related to the independent variable. Research variables or concepts are the qualities, properties, or characteristics identified in the research purpose and objectives, questions, or hypotheses that are measured in a study. Extraneous variables exist in all studies and can affect the selection of subject participants, implementation of the study intervention, measurement of study variables, and implementation of study procedures. Recognized or unrecognized extraneous variables become confounding variables if they are not recognized before the study is initiated and cannot be controlled. As control of these variables decrease, their potential influence increases. Researchers attempt to limit the influence of extraneous variables via inclusion and exclusion criteria of subjects. Environmental variables are types of extraneous variables that make up the setting in which the study is conducted. Examples include climate, home, community setting, healthcare setting, and others. Demographic variables are attributes of subjects that are measured during a study and are used to describe the sample. For example, age, gender, income, education, medical diagnoses, and others. Post hoc analytic techniques enable subgroup characteristics to be identified. Demographic characteristics reflect the demography of the sample and enable inferences to be made from the sample to the population. That is, the population with demographic characteristics similar to those of the sample. Moderator and mediator variables must also be considered in research. Moderator variables occur with the intervention and alter the causal relationship between the intervention and outcomes. Mediator variables are variables that occur as intermediate links between independent and dependent variables. Often they provide insight into the proposed relationship between cause and effect. The authors of your textbook provide an example of baseline sample characteristics and clinical characteristics taken from a study by Ramadi et al. In 2015. The demographic variables included age, gender, and BMI. The clinical primary diagnoses included 8 diagnoses, such as anterior myocardial infarction, asthma, chronic obstructive pulmonary disease, and 5 others. A hypothesis is a stated relationship between or among variables within a specified population. The scientific method rests on the process of stating a hypothesis, testing it, and rejecting or accepting the hypothesis based on findings. There are 4 types of hypotheses, each of which are examined in subsequent slides. These types include associative versus causal, simple versus complex, directional versus non-directional, and null versus research. Associative hypotheses explore variables that exist together in practice. As one variable changes, so does the other. X is related to Y in a target population, or X is positively related to Y in the target population, or X is negatively related to Y in the target population, or, for example, variables X and Y predict variable Z in a target population. Causal hypotheses identify a cause and effect interaction between two or more variables. The independent variable or variables, the variables thought to have an effect on the dependent variable. The dependent variable is measured to examine the effect created by the presence of the independent variable or variables. A simple causal hypothesis predicts one independent variable to one dependent variable, one cause, one result. A simple associative hypothesis reveals the relationship between two variables. No causal variable determined. The null or statistical hypothesis is used for statistical testing and interpretation of results. An associative null hypothesis states no relationship exists between variables. A causal null hypothesis states either the independent variable has no effect on the dependent variable, or the experimental group receiving the independent variable is no different from the control group on the dependent variable. A research or alternate hypothesis, by contrast, states that there is a relationship between two or more variables. The prediction in a research or alternate hypothesis might be based on theoretical statements, previous research findings, and/or clinical experience. A simple hypothesis, whether associative or causal, predicts the relationship between two variables in a target population. That is, it identifies the relationship between one independent variable X and one dependent variable Y. A complex hypothesis predicts the relationships, whether causal or associative, among three or more variables. For example, a complex associative relationship predicts the relationships between three or more variables. A complex causal hypothesis predicts the effects of one independent variable on two or more dependent variables, or predicts the effects of two or more independent variables on one or more dependent variable. This slide illustrates a complex causal hypothesis with one independent variable, that is, one cause, with two or more outcomes or results, that is, two or more dependent variables. It also illustrates a complex associative hypothesis with four variables and the relationships between and among them. The difference between a non-directional hypothesis and a directional hypothesis is that the non-directional states that a relationship exists between variables but does not predict the nature of the relationship. The directional hypothesis, in contrast, states the direction of the relationship between two or more variables. Non-directional hypothesis, for example, dyspnea, fatigue, and sleep difficulty are related to functional performance. Directional hypothesis, for example, breastfeeding during immunizations will decrease the length of crying time and prevent an increase in heart rate during vaccination. The null hypothesis is also called the statistical hypothesis. The symbol capital H subscript 0 is used for statistical testing and interpretation of results. An associative hypothesis, capital H subscript 0, states no relationship between variables. A causal, capital H subscript 0, states either 1, the independent variable has no effect on the dependent variable, or 2, the experimental group receiving the independent variable or treatment is no different from the control group for the dependent variable. The research hypothesis is also called the alternate hypothesis to the null hypothesis. The symbols used for the alternate hypothesis include capital H subscript 1 or capital H subscript small a. The alternate hypothesis states that there is a relationship between two or more variables. The alternate hypothesis can be simple or complex, non-directional or directional, and associative or causal. The prediction in an alternate hypothesis might be based on theoretical statements, previous research findings, and/or clinical experience. A testable hypothesis is one that contains variables that can be measured or manipulated in practice. Hypotheses are tested using statistical analyses, both descriptive and inferential statistics. Associative hypotheses often employ correlational analyses, including Pearson's R for interval and ratio data, and Spearman's rank order for ordinal data. Causal relationship hypotheses employ statistics examining differences. For example, t-test, Mann-Whitney U-test, analysis of variance. Null hypotheses are tested through statistical analyses. Did the independent variable have a statistically significant effect on the dependent variable? The level of significance, or alpha, is set after the generation of causal hypotheses, but before the study is conducted. We will have more on level of significance as our course proceeds. It is critically important to remember that research findings do not prove hypotheses true or false. When the null hypothesis is tested, it is either rejected or accepted. If accepted, it indicates that no relationship was found among the variables. If rejected, it indicates the possibility that a relationship or difference exists. The authors of our textbook provide a figure on page 99 that illustrates the linkage from theory to method. In this figure, the construct is at the philosophical level, the concept is at the study framework level, and the variable is at the hypothesis level. Variables are measured with instruments or tools that are known to be reliable and valid. All dependent and independent variables in a research study must be defined both conceptually and operationally. A conceptual definition provides the theoretical meaning of a concept or variable. For example, anxiety is an emotion characterized by feelings of tension, worried thought, and physical changes. In quantitative research, variables must be operationalized numerically in order for the mathematical operations involved in statistics to be undertaken. For example, anxiety is the subject's score on an instrument designed to measure anxiety. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition, by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.